Okay, so here's another comment that came in when we were reviewing a wheat zoomer. So that kind of heavy sigh. And so Dr. Tom talks on these summits and he says that you have to be really squeaky clean and you can't even have a little bit of gluten or it just, the antibodies stay up. So that just feels overwhelming.
That's so very true. It is overwhelming. It is overwhelming. I've just read a study that came out this year, last month, that 24% of celiac children uh, cheat on gluten-free diets. 24% means 1 out of 4. They cheat because it's difficult if you don't know how to set it up correctly. It really is difficult if you don't know what to do. And you're trying, because wheat is 25 to 40% of the calories in the standard American diet. 25 to 40% of all the calories come from bread and pasta and cookies and muffins and rolls and so how do you tell people you got to stay away from this, especially as some of our patients who have done the wheat zoomer know if you've got positive antibodies to one of the clumps of poorly digested wheat called gluteomorpines, those are the people that say, oh, I don't need wheat, I just like it. They just like it because it's stimulating the opiate receptors in their brain, just like opium would when we do our blood tests and those components come back positive. We always let people know that, it's okay if we transition you slowly because you're likely to have a little bit of a rougher time if you don't really do this comprehensively. What do you mean, Doc? I'm fine, I could do this. Yeah, I know, but you've got these elevated antibodies to gluteomorphins, and that means they're stimulating the opiate receptors in your brain right now. And so it's almost like an addiction that you have. Oh, I'm not addicted to it, I just like it. No, I understand, but let's just take it a little slower, let's just transit, let's get all the breakfast first. So let's start with 2 breakfasts a week that are gluten-free. And then in a couple of weeks, we'll go to 4 breakfasts a week as you learn more options of what's available to you. And then you just have to transition them slowly.
Tom, once they do transition, we sometimes want to rationalize with those elevated gluteomorphin protein to have birthday cake on our birthday. But we wouldn't rationalize having heroin on our birthday, right?
That's a really good point.
So we really can't be like, oh, I'm just going to celebrate, because it's almost like we're celebrating with a little heroin, right? Because it's stimulating those same receptor sites.
Yeah, that's exactly right.